I've compiled a short list of requirements that I believe helps in living with a disability. Now, before I show you the first and most important requirement, I want all of you to take a minute and come up with what you think would be the most important necessity for living with a disability. That'll give me a chance to get a drink. I bet you've never had a speaker who could drink and talk at the same time. Wasn't that just the stupidest joke you ever heard in your life? All right, you don't have to answer this, but what is the number one necessity for living with a disability? Is it a person like a family member, a caseworker, a therapist, a friend? Is it something spiritual like a religion or a belief in an afterlife free from your disability? That's an interesting thought, isn't it? Is it something as simple as an object like a wheelchair, a walker, a communication device, or maybe it's a service animal? I suppose it all depends on the person and their experiences.
But on a more serious note, for me, the most important thing is confidence in myself. Sounds way too simple, but if I can't find self-confidence, then I believe my life matters. Then I believe that I'm supposed to be here. Not only that, I'm supposed to be here just as I am. Then I believe that if I wasn't in a wheelchair, the world would be missing something special. That totally dismisses the possibility that I am, in fact, broken, defective, damaged, impaired, flawed, inadequate. Confidence says, if I want, I can write the next bestseller. I can be the next Bill Gates. I can do whatever I want to do. Having that mindset is 99% of the battle. Confidence, I cannot possibly overstate how important it is. This isn't really part of my normal speech, but I think. Actually, I'm absolutely sure that you as therapists can begin to instill confidence, especially in your younger patients. If you take nothing else away this morning, remember this. More than any adaptive aid you get for them, more than any contraction you make for them, more than any stretching or strengthening they may gain with you, more than any clever technique you teach them to perform an EDL, the greatest, most useful tool you can instill in your patients is confidence. Making them see that despite the loss of their use of their left side, despite their blindness, their deafness, despite the loss of one or more limbs, despite being in a wheelchair, despite not being able to talk, despite being constantly misunderstood, underestimated, looked over, ignored, disregarded, disrespected, despite all those things, making them see that they matter. They matter to the course of human history. My wife tells me that I have a way with words, but I could sit up here for the next 20 years, and I still couldn't convey to you how important confidence is. I hate saying, despite being in a wheelchair, or despite missing a limb, or despite being blind. It's like saying, well, despite the way God made you. And that's just dumb. We should say, because you're in a wheelchair, because you're blind, because you can't talk, because of those things, you matter.
All right, everybody fasten your seatbelts. You're about to get into some serious stuff here. In finding myself, in finding out who I am as a person, I found out that I could really enjoy sex. The women in here are thinking, oh dear God, make him stop. They're thinking, isn't it time for like a bathroom break or something? Can't someone pull his battery out? I promise to be quick. And that's a bit Who knew that someone using the computer to speak could still put his foot in his mouth. The question you have to ask yourself is, did he plan to say that, or did he actually goof up? I recently spoke to a class of ODR students at VCU. I was told that they only received one lecture during their entire program on this subject. That is so wrong. Whether or not we try to avoid it like the plague, it is of paramount importance. It kind of sustains our species. Just saying, it could be an 18-year-old man that just broke his hip and is in a rehab facility. He might not like talking to his wife all that much, but I bet he misses something else. Or it could be a 19-year-old kid who has been conditioned to think that he is not even a sexual being, that he has absolutely nothing to offer a woman, that the only sexual experience he will have will be the continued molestation by his own family member. That speech pathologist who treated me like any other guy, who showed me innocent, unselfish affection, she made me question myself in a good way. Maybe I wasn't such a horribly disgusting little troll. Maybe I wasn't just a cheap object to be used for someone else's sexual gratification. Maybe there would be someone out there who could possibly find me truly attractive, maybe even sexy. It seemed so basic for most people, but that was a serious revelation for me. That same concept, more than all the therapy and all the training I received, propelled me to be the strong, confident person I am today. It sounds very shallow, but there is a very primal need to feel attractive, wanted, validated, and desired in a very intimate way. And it makes no difference whether or not I am in a wheelchair, whether I'm paralyzed, whether I'm missing a limb. I need to feel attractive to someone. Okay, what does this mean for you? When you first saw me, what did you think about me? You probably started diagnosing me. Let's see, he has CP, spastic, very high tone, looks like knee contractures. Maybe you even noticed that my left wrist is fused. How many of you saw me as just another man? How many of you saw me as a strong, virile, powerful man? Why not? Goes back to that perfect image. We let society tell us what's attractive, hot, or sexy. When people see me for the first time, especially women, they never see me as a sexual man. And consciously or unconsciously, that is how women choose their mate. If a man is big, strong, good looking, he's a potential mate. I met my wife online in a chat room. I asked her one day if she had met me in the real world, would she have given me a chance? She started crying because she had to say no. That's human nature, I think. Is it unfair? Absolutely. I'm going to demonstrate my point. Right now, I'm going to need a female to assist me in a little demonstration, and I get to pick the one I want. Now, who do I want? Will you help me? Just as a side note, how much confidence would it take to approach a woman who is this beautiful? I'm going to tell you something that you may or may not believe. Please keep in mind, this is just from my personal experience. This may not be the case universally, and I don't know if it applies to women in my situation either. Okay, for this demonstration, you're not in the rehab field. You have no experience with people with disabilities. You're just the average hottie off the street. That didn't come out right either, did it? Anyway, over here you have a normal able-bodied woman. Over here, you have a guy with a severe disability, cerebral palsy, spina bifida, muscular dystrophy, whatever. Any kind of disability that makes you look deformed. Because why? We always judge people based on, not necessarily on their appearance, but on our opinion of their appearance. Very important. This is not the case of the guy said, a paraplegic. It could be some little boy, band reject, that got in an accident. He's disabled, in a wheelchair, but he's still a pretty boy. It would still be difficult for him, but nowhere near as hard as for someone with a severe physical deformity. If I meet this beautiful young lady out in the real world, there is a gulf or a chasm between us. That gulf is simply my appearance, and what it supposedly represents. I don't care. If I'm sitting this close to her, there is still an emotional, a psychological barrier between us. In her mind, I'm not a man. I'm basically a charity case. I'm someone who constantly needs help. I'm someone to be pitied. And I'm probably not even aware of my surroundings, or that I just parked way too close to her. Anybody want to date someone like that? She isn't aware that behind the seemingly restricted computer, cumbersome wheelchair, and this abnormal body, that there is actually a man. She doesn't understand to wait for me to type out what I want to say. All she knows is this little retarded guy has just parked his wheelchair way too close to her. She isn't going to sit there long enough to figure out that I am in fact typing an intelligent message to her. And I don't mean, what color underwear are you wearing? Please don't tell me what color underwear you're wearing. I feel a little awkward. But with that said, this may sound totally stupid to you, but from my experience, the only thing that bridges that gap is if this woman finds out that this little handicapped guy can't have sex. All of a sudden, she is thinking of me in a totally different light. In her mind, I went from a little helpless crippled guy in a very cumbersome wheelchair. Now, at the very least, she either wants to know more about me, or she is disgusted by the very thought. At least I have a 50-50 chance, as opposed to just being a helpless crippled guy with absolutely nothing to offer her. And even better, if she finds out I'm really good at having sex, she becomes very curious, and there is nothing more attractive or addictive than a curious woman. That allows me to come over here and be close to her in every way. I can't sit here and make her laugh. I can't touch her hand as a real man. Over here, I couldn't do that because she only saw this wheelchair, and whatever this thinks, she didn't see my sense of humor. She wasn't aware that I am, as my wife says, ridiculously intelligent. She didn't see my masculinity because, hell, she probably didn't think I had it. But here's the problem, and I never recommend doing this. Seriously, don't try this. Hi, my name is Johnny, and if you have sex with me, your screams of ecstasy will crack the very top. good line, just not the best opener. This conversation is going to end rather rapidly, with a slap across my face. Do you see the dilemma? For guys like me, most women won't consider us until they find out that we are actually men, that we have a masculinity, that we are sexual. But if we try telling them that in order to keep them from running away, it freaks them out and destroys any possibility of relationship. So guys like me are forced to meet women online. Online, this whole thing with the gulf and trying to bridge that gulf is irrelevant. She can't see me. I can be as funny, as romantic, and as intelligent as I want without worrying about convincing her of my manhood. And when I choose, I can tell her of my disability. If she decides to bail out, that's fine. But I can't show her the real me before she has to face the disability. It is unfortunate, but initially, the woman has to overlook, ignore her, and endure my disability, rather than respect, embrace, and enjoy it. Thank you so much for your help.
That brings me to the last necessity for living with a disability. I have to live my life. This used to be just a wrap-up point for me to close my presentation. But in the past year, especially in the past couple months, this concept, by and large, has revolutionized the way I live my life. Ever have an ideology just knock you upside the head like a baseball bat? Happened to me. Whether or not you believe in a heaven or a hell, whether or not you believe that when we die, our spirits remain here on earth affecting those who are still alive, whether or not you believe in reincarnation, or whether or not you believe that when you die, you simply cease to exist, whether or not I believe in an afterlife is irrelevant in the here and now. It doesn't matter if I will have a golden castle full of treasures beyond all comprehension when I die. It doesn't matter if I'll have 200 virgins or my own planet or whatever else we think we will have when we die. None of that matters. I am living in this very moment on this planet. I'm not living 5 seconds ago or 100 years from now. What am I doing in this time? Am I enjoying myself? Am I making memories? Am I learning something? Whose life am I impacting in a positive way? Am I making a difference? I often ponder the meaning of life and all of its intricacies. My wife will tell you that I sit and think way too much. I think it boils down to a question of purpose. Without purpose, life is indeed pointless. And I don't think anyone can tell you what your purpose is. I don't think you can find it in any book or at any seminar. I think you simply find out whatever makes you happy. This is my purpose. This makes me happy. Sitting up here in front of intelligent people, enlightening them on disability issues, giving them a different perspective, inspiring them, even just making them laugh. I found my purpose. I found what I want to do with the rest of my life. This is the work that I hope will make my wife and maybe our future children proud of me. This is how I will leave my mark on the world. It took me, 33 years to find my purpose. Sure, I could be consumed with regret that I didn't find it earlier in life. But some people never find their purpose. They live out their years, work a dead-end job, maybe have children, maybe even die wealthy, but they never found that one thing. That drives them, that excites them, that one single thing, that fulfills their life. It's nice that we can make a living fulfilling our purpose. But it really doesn't matter if we die, penniless, if we are doing what we love. We may be 50, 60, even 70 years old. Doesn't matter. Find your purpose now. After you find your purpose, you can use it to be pivotal. Last year I spoke to that class of OT students that were about to start their first fieldwork assignments. Dr. Tony Gentry, who is a professor of OT at VCU. He's the reason why I'm sitting in front of you today. He took time out of his busy day, made contact with, I'm assuming, Miss Judith, recommended that I not only speak here, but to keynote the whole conference. This is the biggest speaking engagement I've ever done, by far. I guess when someone like Tony recommends you take the batter's box, you try to knock the ball into the next zip code. It's the same with Miss Judith. She didn't know me from Adam. All she had was Tony's recommendation. That speaks to his credibility, but more so to Judith's open-mindedness to give an OT like me a chance to make my impact. To individuals making a positive impact on who knows how many. These are some people who have influenced the way I live my life. Albert Einstein. He revolutionized our understanding of the laws of physics, the photoelectric effect, which was pivotal in establishing quantum theory. My fascination with physics, quantum mechanics, and such things doesn't necessarily mean that I'm smart. It probably just means I'm weird. Everybody knows this guy, Stephen Hawking, the most well-known scientific mind of our time. While I don't agree with all of his theories, I respect the man for his incredible intelligence and his conviction for what he believes. He's a perfect testament to sheer determination. Whether you like him or hate him, President Roosevelt led us out of the Great Depression and led us to victory in the Second World War. But for me personally, he was pivotal in my life for founding the rehab facility in Warm Springs, Georgia. If he hadn't, I wouldn't have ever gone. I wouldn't have ever become the man, the husband I am today. This man's struggle for racial equality resonates with me. I fight for the same equality, but my fight isn't about skin tone. It's a fight for equality across all ability levels. The idea is that I am equal to the able-bodied person. I am as needed, I am as necessary, I am as vital, I deserve no less respect. My life is as significant as anyone else's. I think that man would agree with that idea. What do you think? Miss Rosa Parks. She taught me to demand respect, to demand equality. You might find this totally strange, but there are people who can't accept that I am equal to them. Again, it perfectly parallels the racial bigotry between white and black people. If I am an able-bodied person, albeit ignorant, and if someone tells me that this little seemingly retarded person over here is equal to me, in my ignorant mind, that makes me less of a person. I can't accept that. I won't accept that. It hurts my pride. I'm supposed to be the epitome of what it means to be human. I deserve the best of everything because, in my opinion, I'm normal. All this little guy over here deserves is to be tolerated as a second-class citizen and supported by my tax dollars for the rest of his insignificant life. That sounds harsh, but trust me, I've seen it all my life. So did she. Some of you will recognize this guy, Les Stroud, the Survivor Man. He was the guy who piqued my interest in the outdoors, camping, learning survival techniques. He inspired me to have my own adventures, to venture out of my comfort zone, to live my life to the fullest. He has to be one of my heroes. This woman here, my wife, I could talk about her all day. That would just make her cry and ruin her makeup. But I will simply say that she makes me want to be a better man. Isn't that just the prettiest dog you ever saw in your life? I really don't even know how to tell you this. So I'll just say it. 2 months ago, I lost this beautiful girl to renal failure. Her name was Bree. She was a pure English lad, and she had just turned 6. Isn't she gorgeous? Something I found that works for me. Sticking your tongue out helps you to keep from crying. I promise I won't be offended. She was something else. She had the best personality, so playful and so gentle, especially with kids. Sweetest, most lovable dog you'll ever meet. May of last year, my wife was working at a nursing facility in Farmville. She disliked many things about the facility, but the administrator needed someone to adopt Bree. His 3 kids were growing up, very busy with after-school activities, and they didn't really have time for Miss Bree. One of the other therapists mentioned Bree to my wife. We decided to keep her while her family went on vacation, just to see how it went. We never gave her back. She was already trained to perform the normal commands: sit down, stay, come, shake. I taught her a few things. I taught her how to walk with me on my left side, watching me for when I make left turns. I taught her to stop automatically when I stopped my chair, and to move when I moved. And yet all the training I did with her, all the things that I taught her, nothing compares to the incredible lessons that she taught me. The first thing she showed me was a truly blind eye to my disability. It was the most beautiful thing. When she wanted to go out, who did she come to? Dad. When she was hungry, sometimes she wouldn't eat unless I hold her food in my hand and let her eat out of my hand. When she wanted to play, when she wanted to go for a run, when she wanted her booty rubbed, she came to me. She had no idea that running with me was any different. All she knew was Daddy was running with her, and that she was happy. She had absolutely no apprehension, no uneasiness, no uncertainty, no anxiety about obligating me to uphold my end of our relationship. Discrimination, bigotry, preconceived notions, any excuses due to any extenuating circumstances, none of that had any meaning to her. The concept that I was disabled, or even just different, never even entered her mind. If we played tug-of-war, worrying about pulling me out my wheelchair is the absolute last thing she was concerned with. Daddy is playing with her. That was the only thing on her mind. I was her dad, her master, her pack leader, whatever you want to call me. The disability, the wheelchair, the speech impairment, the spasticity, none of it had any bearing on our relationship. That had to be the most beautiful relationship. It had to be probably 5, 6, 7 months after she adopted us. It started to dawn on me that this dog had absolutely no concept of yesterday or tomorrow. Last week, next month, next year, 10 years from now, none of that had any meaning in her beautiful mind. Sometimes she and I would sit and stare in each other's eyes, and I could tell she was 110% focused on that very moment. Nothing else mattered to her in that moment. She wasn't frustrated over whatever happened earlier that day. She wasn't making any plans for tomorrow. All she knew was in that very moment. What a way to live. She also taught me to take every opportunity to help someone, to make someone smile, to brighten someone's day, or to just experience something new, even if it is out of your way, even if it involves a lot of work, even if it cuts into your personal time, even if it's something totally new and totally outside your comfort zone. Do it. It's a safe bet that you won't have that opportunity again. Experience the experience. I made that up, or at least I think I made that up. My wife has a tendency of staying on the beaten path, not taking chances, not trying new things, staying well within her comfort zone for fear of not liking what she finds outside. I tell her, when she has an opportunity to do something that she may or may not enjoy, go for it. If she tries it and doesn't like it, fine, she'll know for sure. If she never tries it, she might be denying herself something. That could bring her a lot of joy. I think we had to go outside of our comfort zone when we took Bree. Imagine the incredible blessing we might have passed up if we hadn't taken that chance. I guess the last thing Bree taught me happened when we found out she was sick and she wouldn't have long to live. Initially, she was oblivious to the fact she only had a short time left. She obviously knew she was sick. But when her time was drawing near, I could see in her eyes that she knew, and yet she still tried to be her sweet, inviting, playful self, even though it was totally obvious that it was a struggle for her to do so. Now I have no idea if she was doing that for our benefit, or if that was just the way she was. I like to think my baby was being a trooper for us. Nonetheless, the lesson was clear, at least to me. Put everything you have into every moment. Enjoy it. I figured we would have free for another 10 years. 10 years of running, playing, laughing, loving. 10 years of going to sign, and all of us having a burger and fries. 10 years of memories. There's a quote in one of my favorite episodes of Star Trek. Make now the most important time, because now will never come again. None of us will ever be right here, right now, ever again. Are we living in this moment like my brief baby did? Okay, go back to all of these people and K9. All of them have had their impact on human history. Most of them are in history books. Most of them are famous and renowned for their accomplishments. A couple of them are relatively unknown until today. The question that I pose to you is this: what is the difference between these famous people and you? What makes these people more important than you or me? What makes these people more pivotal to history than you or me? You see, we think greatness is reserved for certain people. Certainly not us. Not so. Greatness is a choice. You don't have to be president. You don't have to be a famous scientist. You don't have to be a genius. You don't even have to be an astronaut. Greatness isn't about that. Greatness is simply making an impact, making a difference. This is how I make my impact. This is how I make a difference. This is how I will be remembered. You have the opportunity every day you go to work to make an impact, to make a difference. One patient at a time. Despite your working conditions, despite the pressure from your employers, despite the insane amount of regulations and paperwork, every single one of you is capable of greatness.